Hi, my name is Jonathan Finoff, and I'm going to be demonstrating a live ultrasound examination of the posterior hip. I don't have any disclosures, but I do have a disclaimer. This presentation is not meant to be a comprehensive review of this topic. Our objective is to cover the core competencies as outlined in the AMSSM recommended sports ultrasound curriculum for sports medicine fellowships. Now we'll do a musculoskeletal ultrasound examination of the medial ankle. You can see that we have the subject placed here, the patient placed here, so that the lateral aspect of their ankle is towards the table. There's a bolster underneath the lateral aspect of their ankle, and it allows the ankle to fall into a little bit of eversion, and that puts the medial ankle structures on a little bit of tension. So here we are coming into the medial aspect of the ankle. I'm going to increase the gain a touch here. I'm going to change my focal zone a little bit. Okay. So a really nice home base in this area is going to be just posterior to the medial malleolus. So here's the medial malleolus. Here is some flexor retinaculum coming off over the top of the tendons. The first tendon just posterior to the medial malleolus is going to be your tibialis posterior tendon. Just posterior to that is going to be your flexor digitorum longus tendon. That arrow did not want to go. So here's the medial aspect of the ankle. So here is the medial malleolus, the flexor retinaculum coming across this area. The first tendon posterior to the medial malleolus is going to be your tibialis posterior tendon. Just posterior to that is going to be your flexor digitorum longus tendon. Then you're going to have your neurovascular structures right in this area. And then a little bit deeper and back in this area is going to be your flexor hallucis longus. Can you wiggle your big toe for me? So you can see here, here's some muscle and here's some tendon of that flexor hallucis longus. We'll look at that a little bit more as we get further into this examination. So let's follow this tibialis posterior down distally. So we just went around the medial malleolus. We're going a little bit distal. We can trace it all the way down here to the medial aspect of the ankle. You can see how it flares out and becomes a much broader and more heterogeneous tendon as it comes down because of its broad insertion. And that is not pathologic, that is normal. You can also sometimes see some fluid around the distal aspect of the tendon in the tendon sheath in this area. It should not be circumferential, it should only be partially around the tendon, and that would again be normal. If it was all the way around and circumferential, then that's pathologic. If I rotate the transducer, we can certainly look at that tendon in long axis as it comes down, and you can see how it really becomes a much more broad-based tendon as we come down distally here. So if I come back up more proximally again to that medial malleolus, and this is sort of home base, and I look just posterior to the tibialis posterior tendon, here's the flexor digitorum longus tendon. So I can follow that down distally as I'm coming down here. Right here is the sustentaculum tali. So the sustentaculum tali, this bone right here is off of the calcaneus, and typically the tibialis posterior sits above it, the flexor digitorum longus sits on it, and the flexor hallucis longus sits deep to it. So we can follow that flexor hallucis longus down here deep to that, distal to the sustentaculum tali. And as I come down distally here, I'm going to come back up proximally just to... Can you wiggle your big toe for me here? So right here is the flexor hallucis longus tendon. Here's the flexor digitorum longus tendon. And as I come down distally, those two tendons are about to cross. I'm going to change the location of the focal zone here. So right in this area you can see the two tendons. So here's the flexor hallucis longus. Here's the flexor digitorum longus. So wiggle your big toe again for me, flexor hallucis longus. And the flexor digitorum longus is right here. This is called the knot of Henry, and this is a site of potential pathology because the tendons are crossing one another. And you can follow those all the way out to the big toe. So I'm coming back up proximally, back to the ankle. So here's the medial malleolus again with the tibialis posterior tendon, the flexor digitorum longus, and here are the neurovascular structures. So the posterior tibial artery and the tibial nerve. Now I'm going to look at the tibial nerve. As we come down distally, you'll see the tibial nerve separating into I'm going to come back up proximally again here. Here's the tibial nerve as one whole piece. As I come down distally, it's going to separate into two branches. So right here, it's going to be the lateral plantar nerve. Here's going to be the medial plantar nerve. So you can see the two branches of the nerve right in this area right here. So lateral plantar, medial plantar. All right, coming back up more proximally. Down in this area is the flexor hallucis longus. So this is flexor hallucis longus muscle and tendon. As I come down distally, the flexor hallucis longus tendon is going to come here in the posterior process of the talus between the medial and lateral tubercle. Go ahead and wiggle your toe, big toe there, so you can see how this tendon moves here. And this is a common site for stenosing tenosynovitis in people who do a lot with their big toe, such as dancers. And again, you can follow it down distally. So here's that flexor hallucis longus tendon again, right in this area with the sustentaculum tali. And you can follow it distally to the knot of Henry, as I demonstrated before. Ligamentous structures on the medial aspect of the ankle, besides the flexor retinaculum, which I showed you before, the main ligament is the deltoid ligament. And the deltoid ligament has superficial and deep components to it. And so the superficial component here, the deltoid ligament, is going to go from the medial malleolus, so here's the medial malleolus, all the way out to the navicular, and here's the navicular right here. Here you can see the head of the talus. So there's the ligament coming across. And there's a deep component of it right here, and that goes from the medial malleolus to the talus. And if I change the transducer location, here's the sustentaculum tali here, so that's plantar. And here's the medial malleolus. You can see coming off of that medial malleolus and coming down to that sustentaculum tali area, you can see a ligamentous structure coming across, coming down right in that area. And that ligament is the tibiocalcaneal ligament. So you can see it right here. So those are the portions of the deltoid ligament that you can see quite well with ultrasound, coming down to the sustentaculum tali. And that completes the medial ankle examination.